What if the one thing that was meant to break you had the power to help someone else to survive? Welcome to Healing Through Chaos, the podcast where pain is transformed into purpose through powerful storytelling. It's the one place that you'll find licensed professionals and survivors meet at the same table to talk lived experience and expertise. I'm your host, Jontai, and this is where your healing journey begins. On today's episode, we talk advocacy, specifically LGBTQ plus advocacy with Dr. Lulu. Welcome, Dr. Lulu.
Thank you so much for having me. And you know what? It's actually Pride Month. So yes, happy Pride Month. What a beautiful time of the year. I mean, I think Pride is every day, but just like Mother's Day is every day. But at least we have a month. So happy Pride Month to all my queers out there, to all my allies out there, to all those who are still considering coming out there. I just want you to know that you're seen, you're loved, you're valid, your life matters, and I wouldn't have it any other way. I wouldn't have it any other way.
Absolutely, absolutely. And are you ready to get into today's conversation?
Let's make it happen. I was born ready.
Let's go. So take us back to the moment where your child came out as a transgender. What did that experience feel like for you as a parent in real time?
I think it's probably best to answer that question by saying that I was born, bred, buttered, and slightly burned in Nigeria. And I say that because Nigeria is one of the most religious countries in the world and also one of the most homophobic countries in the world. So growing up myself at the age of 9, between 9 and 11, I told my auntie, I said, you know what, I like boys and I like girls. And my aunt, who was raised Catholic just like me, she was like, oh, don't say that now, because you're going to go to hell. And I was like, wait, hell? He was like, yes. And so as an impressionable 9 to 11-year-old child, you can imagine when someone you trust, someone you love tells you something that huge about something that you didn't make yourself. Like I just knew at the age of 9 that I liked girls and I like boys. I mean, just like anybody else likes boys or likes us to like girls. And I go back there because it's important for us to recognize the kind of society that we're all raised in. I was raised in a very cultural, very patriarchal, very religious country called Nigeria. And so I didn't have a chance. And most queer people to this day don't have a chance. And so when I told my aunt that and she said those words, I was like, I am never saying that again to anybody. And I don't even want to be this person. And I want people to understand that. Nobody that is gay says, oh yeah, God, give me gay with a side of fries and some ice cream with it. Well, and supersize my drink. No, nobody's asking for that. So when you find yourself gay, you're confused because it's like, wait, why is the society telling me that I should not when in my heart, I am? And so I say that to say that growing up, I also had to, most of my life was in the closet because I was like, I'm not trying to be gay. And then I went to an all-girls high school. So you can imagine, as a high schooler in an all-girls boarding school, and I like girls, it's like a buffet that you can't eat out of. And so these are the realities. And then I got to medical school, and I was told in the 80s when I went to medical school that, oh, being bisexual is a mental illness. Never mind that by 1973, the word homosexuality was removed from the DSM. DSM is the Diagnostic Statistical Manual, which is the book that psychiatrists use to look at psychiatric diagnosis. The word homosexuality was removed from there as a mental illness, which in the first place, whose idea was it to call it a mental illness in the first place? But anyway, it was removed. And I went to medical school between 86 and 91, and I was still told then that it was a mental illness. And so I really grew up not liking the fact that I was queer, not liking that part of myself. And then fast forward, because I'm bisexual, I'm equally attracted to men and women. On a good day, women, on a bad day, men, on a good day, men, on a bad day, women. And so I was married to my ex-husband. And for all intents and purposes, I was living my life as a heterosexual person, but I knew deep inside that I wasn't. That said, here comes my first kid, acting all girly all the time, she tie her sweater on her head. So, Mom, look, I have long hair. I'm like, no, you don't, right? And then she tie her sweater around her waist and say, Mommy, look, I have a skirt like a girl. I said, no, you're not a girl. So I want to see that even when I was raised in that environment. When my kid came along, I was still did the same. I still repeated the sins of my forefathers. I was like, no, you're not. Please don't be gay. Please, God, don't make my kid gay. Please, God, don't make my kid gay. And here's the thing. I'm busy saying, God, don't make my kid gay, right? And then when you ask me why, and I'll be like, well, I don't want the world to bully the child. I don't want the child to have a hard time. But in the meantime, I'm my child's first bully. I'm going to let that land. I was the first one to tell the child not to wear the scarf around the head. I was the first one that said, you're not a girl, not the person outside. And so let's be careful what we're thinking and what we're saying and what we're doing, right? I was thinking to myself that this is the way to protect the child. Was I really protecting the child though? And then from whom?
Yeah.
Ever before your child gets to the outside world, ever before your child gets to the governor of your state, ever before the child knows about the president who's making anti-gay laws, your child knows you. And so it's very important that we recognize that no matter what we do, we cannot make our kids gay or straight. And let me tell you something, if being around gay people will make people gay, then being around straight people should make people straight.
Right.
Then that means all straight people should be gay and all gay people should be straight, but it's not like that. And so,
yeah. And
so my kid tells me she's transgender, and of all the things, because that was a little bit later in life. First of all, I thought he was gay, and I was younger. And then at 12 years, I said, "Are you gay? Is you gay or is you not gay?" She was like, "I don't know." And the normal parent who hears "I don't know" will be like, "Okay, I don't know." But when the child said "I don't know," I heard no. And so I took it and ran with it. But the child never said no. The child said, "I don't know," because that's what kids will say so that their parents don't come at them. Mm-hmm. The truth is, children don't want to disappoint their parents. No child ever wants to disappoint their parent. So the child is going to lie. The child is going to pretend. The child is going to freaking cut themselves, do whatever just to be conforming to what the rules in the house. So who, again, is the first bully? Imagine me telling you, don't be a girl. No, do not comb your hair. Don't brush your hair. Don't look pretty. You're not a girl. But you know deep inside your soul that you're a girl. So gender identity is a deep, personal, internal sense of who I am. Nobody can assign that to me. What people get assigned at birth is a genital identity. That's what I call it, because it's based on their genitalia. But that's not who I am. That's just what my hormones got my external genitalia to be. But there are people who are intersex all over the place. About 3% of the world is intersex. So 3% of 8 billion people is a lot of people. So not everybody fits neatly, right? I just wanted to answer the question that I came from that background of this is not good, you're not good. And so I was not expecting that. And then when I made peace with the gay, here come non-binary. I said, wait, I thought you were just gay. What is this non-binary? And then I try to make peace with non-binary. Here come transgender. I said, wait, okay, hold up. Which is it? So the answer to the question is there's a difference between sexuality and gender identity. Sexuality is based on who you are attracted to, male or female. Gender identity is based on who you are, male or female, somewhere in between, none of the above, right? Many people don't know that. And so they just hear LGBTQ plus and just think everybody's the same. They start thinking about gay sex. That's not it. There's a letter A is asexual. Those people, They don't even care about having sex. So what are you talking about again? So of course I was shocked. Of course I got on the ground. I fell on my knees on the ground. I said, God, please, of all the things, why this? And then eventually God said, well, why not you? Why not you? You're a mom, you're gay, you're a pediatrician, you're a doctor, you're a speaker, you're a professor at the medical school. who do you want me to tell to do this work? Yes.
And again, thank you, Dr. Lulu, for sharing your story, because you're right. A lot of times, and I've seen it in my family as well. And a lot of people don't even think of it this way as, them being the first bully. And, I've heard all types of names, referring to this community. And it literally is coming from a mom or a dad or a brother or a sister oftentimes, and it shames them. And, you mentioned cutting, but I know some is literally driven them to drugs. And
Warning. Some people unlive themselves. This is real.
yeah,
This is real.
exactly.
And a lot of queer people, and I do use the term queer, like we're talking about before we went online, I do use the term queer because we have reclaimed the word. It's not a derogatory word to us. So a lot of queer people, honestly, they will go to their graves before they ever open their mouth to say that they're queer. Nobody wants that.
Mm.
Now, if they are already gay, then they want to make the best of it, right? It's like, I'm going to come out and I'm going to be loud and proud. And you know what? If you don't like it, that's a you problem. But I'm not going to mute myself and edit myself and diminish myself so that you can get comfortable. You figure that out. In the meantime, I'm going to live my life out loud over here. So that's what ended up happening. Somebody can be gay and non-binary. Somebody can be gay and transgender. Somebody can be gay and two-spirit, because one is gender identity and one is sexual identity. So they're completely different.
Yeah, absolutely. And let's talk about some of the immediate challenges. Were those some of the immediate challenges you were facing internally and externally as you began navigating this new reality with your daughter?
Honestly, that's a beautiful question, because I think a lot of times we, as human beings, we assume that the biggest challenges are going to be from the outside.
Mm-hmm.
The biggest challenge I had was me, myself, and I, was what I thought about the queer community. It was my own thoughts that came from me. Oh my God, they're going to judge me. Oh my God, people are going to say such and such about me. Nobody cares. They're too busy trying to pay their bills. And if they care, that's a them problem, because we do not care. Now, I say that because a lot of parents, I coach parents, I coach physicians, they want to lose their minds when they hear that their child is gay. But truly, what it is that they're suffering from is what they think people would think about them.
Yep.
Whether people think about them or not. When was the last time you thought about your neighbor?
Oh,
when was the last time you thought about the random woman down the street whose child is gay?
I never. Actually,
but the lady's like, oh, everybody's thinking. No, we're not. And so my first and biggest struggle was my own thoughts. And so in my book, God, where my book at? In my book called About Your Black Transgender Child, I don't know where it is. In that book, I tell the parents, I say, before you ever have a child, you have to ask yourself, what are my thoughts about the queer community? What are my thoughts about transgender people? Because if your child turns out to be transgender, you're stuck with your thoughts. So you have to first go and analyze those thoughts and then ask yourself, where did that thought come from? If it came from society, you have to question it. If it came from a gay person who is out and proud, it's going to be different. And so which one should you believe? The person who is living the life, or society who don't even know your child?
Exactly. And
so yeah, most of my suffering was self-imposed, my love. I was like, oh my God, everybody's gonna think, who is everybody? The 5 people that I know? Who is everybody? But it's a way we think. So as a man thinketh, so he beeth, right? So we've been thinking that being gay is bad. In the Black community, we think that is, your child can rob 25 banks, RAPE, 25 women, on live 25 people, and you be like, yeah, but just don't be gay.
You're right, because I've seen it myself. They would rather their kids be criminals than be gay. And, you know, a lot of them like to blame religious beliefs and all of that. But I've seen it myself. And growing up, you know, I was always a person that was very accepting of the community. And originally, I thought to myself, just like you know, I was going through that internal thing of everybody's judging me. Nobody wants to be around me. Is a straight man ever going to be attracted to me because I hang around gay men? And sure enough, all of that was internally. I started talking to straight men. They didn't have any problems with my gay friends.
And listen, if they have a problem again and again and again, it is a them problem.
True statement. And a lot of times, too, is because, and I've seen this, they hate that that person is so courageous to be, and they want to come out themselves, but they're fearful of what society is going to say.
Boom. So one of my personal equations that I made up, I said, the loudness of your homophobia, for those people who are math buffs out there, the louder your homophobia, the deeper and wider your closet.
Yep.
Because why else would you be worried about somebody else's, like, what's your problem? But your closet must be so big and so deep and so wide. And that's why it bothers me, because how dare I live my life out loud? How dare I? But if you meet someone who is not homophobic, they're like, yeah, I mean, it's fine. Yeah, sure. Invite your friend. I want to get to know him.
Exactly. And that's how I kind of was with all the dudes I dated. I would love to bring them around my gay friends just to see what their reaction was, because I knew that if you became very homophobic or just said, get me out of here, I knew then you was hiding something yourself. And I did not want anything to do with you. So that is a good thing to bring up as well.
And also your kids might not be safe around someone who's homophobic. Because if you're homophobic too, especially towards Black people, what else are you?
Exactly.
Because homophobia is really the true definition of hating. Homo sapiens is human beings. So homo, and then phobia is a deep, irrational fear of something. That's a phobia. So you have a deep, irrational fear of your fellow human being in a religion that says, love thy neighbor. I have a problem with that.
It really doesn't. And can you share a moment with our audience where you realize how powerful affirmations, or the lack of it, can be in a young person's life that may be thinking about going through this?
Yeah, so one of the things I teach is the difference between acceptance and affirmation. But also, I'm going to LA next week and I'm going to be giving a keynote titled Bias Begins at Home. And I love that, because usually when I go running, I come up with all my ideas. I was like, you know what? The very first place a child was ever told, don't play with that kind of person, is at home. So bias begins at home. And if bias begins at home, then that means affirmation also begins at home. Because bias is basically a sentence, it begins as a sentence or a story that you're told, and then you're told repeatedly, and then it becomes a fixed belief. When I was young, I was raised Catholic, and I didn't know anything, the meaning of I believe in God at the age of 2, right? But as a Catholic, I was told every single day, I believe in God. I was told by the church, my parent, every single day. And so it became a fixed belief. I didn't question it anymore. I was just like, oh, yeah, I believe in God. But where did that first come from? My parents, because I wasn't born knowing that I believe in God. Same thing, right? You are not born hating somebody else. Racism is a learned behavior. And it's a choice. Homophobia is a choice. Being homosexual is not a choice, right? But if you choose to hate the person, you are saying to yourself that this person is not worthy of anything. And so being homophobic is my thing. I said, okay, if you remove that homophobia, the other thing you can tell the person is, you are who you said you are. That's affirmation.
Yeah.
And so for me, my book, literally my brand new book that I'm working on right now, the opposite of bias in my book is affirmation. Because I feel like if bias means, oh, you're not, or how dare you live out loud? I'm judging you, right? The opposite of that is, oh, wow, congratulations of discovering who you are. How can I support you? That's affirmation. That's me saying you are who you are. I recognize it. I respect it. And I even want to support you. Now, acceptance is different. Acceptance is like, you know what? All right, I know you're gay, but don't bring it here. You know, I mean, yeah, sure. I don't hate you. I just don't want you around me. That's conditional. That's like, I'm going to accept you up to a point. Affirmation says, no, I'm going to support you as you are wholeheartedly. So in the queer community, we talk about affirmation. That's gender affirming. Affirming means bringing you into the body that you feel that you are. So affirmation means I not only love you, I not only accept you, I also want to advocate for you. I want to support you. I want to do whatever I want to do for you to thrive.
Wow.
So it's more powerful. It's like saying acceptance is passive and affirmation is active. Wow. It's like, can't be an ally. Yeah, but I'm an ally sometimes. No. And so my phone is always upside down because it has the words visible ally. I want people to see that I am an ally. I'm not hiding my allyship. I always have a bracelet on my left wrist, always, so that queer people can see me. I have a ring on my right finger, so queer people can see me as an ally. I'm not afraid to show my allyship. I'm not afraid to affirm people. Someone who's like, oh yeah, I know my son, he gay, but that's just him and his friends. It's like over there. Mm-hmm. Acceptance to a point. But if he's really your son or your child, should your love be conditional? No. So that's how I look at affirmation, is a totality of recognizing, respecting, and then also supporting the child. So that means you're going to go to war for them. That's my kind of person.
Thank you for breaking that down, Dr. Lulu, because you even educated me in that conversation, because I thought acceptance meant exactly what you described affirmation as, and had absolutely no clue that it was that limitation there. And a lot of people don't address that part. And you have a lot of people out here saying, I'm an ally of this community, and they put that limitation there. Just like you said.
Yeah, but I accept him. No, yeah, exactly. I accept my child. Oh, I accept my child. But I'm not going to no pride event.
Yeah.
See, that's the difference. I accept my child, but I'm not going to no pride parade. I never now, who affirm their child, like, when is the pride parade? What do you want me to wear? Can I bring my flags? Whatever. That's an affirmation. It's like you're outwardly doing this thing. That's where I see it. Now, this is not a textbook. This is just where I teach my parents, because I want them to know that affirmation is unequivocal. There's no a little bit. The other one, you can also say tolerate. People that say acceptance is like they tolerate, like, yeah, and Susan is here, but she's going to be leaving very soon. I can't wait for her to leave. That's tolerating. That's like, I mean, she here with all her loud gay friends. Jesus, I can't even wait for them to leave. That's tolerating. Affirming is like, yo, Auntie Susan is here with all her givers. When are y'all coming? Because we going to party all night. That's affirming. It's like, let them be who they are to help them thrive. Put that thrive there so that they are going to grow and bloom and be all that they can be. That's affirmation.
Oh, you just opened even my eyes, who was walking around saying that word acceptance and not really truly knowing what that meant. And a lot of people referred to a lot of the examples that you gave as homophobic. And see, when you actually have the professional sitting in the room with you, they're able to say, no, that's acceptance versus you being an ally. I've seen the discussion. I just did not fully understand what the discussion was entailing. And so that was definitely a highlight for me, because you just opened my eyes.
If you go to the dictionary, because I teach this in medical school, I teach LGBT plus awareness, I teach about affirmation, I help physicians go from, because we're not taught in medical school. Right. Most Medical schools don't teach this in the curriculum. So for me, as a queer person, I developed my own curriculum because I was like, okay, what would I have needed to know? Now there's a curriculum. There's AAMC has a curriculum from 2014. So it's outdated, but still, at least it's better than nothing. But I'll ask myself, well, what would I have wanted my parents to do? To this day, as God is my witness, June 8th, my kid is not mentioned about in my house. That is not, everybody else's kid is mentioned in the house, but my kid is not. So I'm not here because everything is fine. I'm here because I'm the child's mother, and it stops with me. It stops with me. If I'm not an outward ally for my kid, what am I? What am I?
If you're a mother, you literally turn
Period.
a beast when it comes down to your child. It don't matter.
It's over.
I mean, it could even start with you and end with you. But when you're a mama, baby, everybody in the room can get it.
Jontai, hold this for me. Hold it for me, baby girl. I'll be right back. Right?
Exactly.
That's it.
Exactly. There you go. There you go. And I want to talk about how has your relationship evolved since your daughter has come out?
So believe it or not, there are lots of things that people assume. We have a strained relationship mainly because of my relationship with my parents. My parents are not particularly affirming. They're older, and my kid doesn't like that, but I'm in the middle. So it's like, yeah, but I said, my parents are from a different generation altogether. It's not, I mean, yeah, they use the name from time to time, but my dad is still stuck in his pre-colonial ways. So for me, I'm still on, I can hold both. I can hold my parents who are working on whatever they're working. My mom is doing a whole lot better now. And I can hold my child who is also out and trans and princess and living her best life. And I can hold the two. Mothers can do those things. I don't know that the dad can, well, he's passed on now, but mothers can do the two. So while our relationship is strained because of that, my work is also about me also being a queer person and me also being an example of what's possible, that you can also live your best. I just found out when I was 55, 2 years ago, that I'm pansexual. My whole life, I thought I was bisexual. Before that, I thought I was a lesbian. So it's always in evolution. And it's a beautiful thing to discover that, oh, wow, so this is who I am. Oh, this whole time I thought I was this. So that's what affirmation is. This whole time I thought I was accepted. You learn, and once you learn something new, you can't unlearn it. When I was younger, I only knew lesbian. So I thought I was a lesbian. Then I realized, wait, but I'm attracted to men and women. Mm-hmm. So, but that's not a lesbian. Then there's a word called bisexual. Oh, I guess I'm bisexual. And then I had this guy that I had the worst crush on him. And he's transgender. I'm like, wait, what? And I have to go and look and say, oh, there's a term for that. It's called pansexual, when you're attracted to men, cisgender women, transgender men. So everyone, regardless of their genitalia or their gender, that's called pansexual. I'm like, oh, well, so what else am I? I was like, okay, what? Oh, I'm also asexual, something called demisexual. Demisexual means I might have like someone that I'm dating, but I'm not that interested in sexual activities until I connect deeply with them emotionally. Many people are like that, but they don't know that it's called demisexual. So when I tell you that the whole world is probably gay, people don't know that, but you don't know, and then you're homophobic. You don't even know that you're even part of the community that you're homophobic about. Many was like, oh yeah, because when I go into a room and I'm talking, I say, okay, does anybody know the meaning of the word? Well, my queer people, and they're like, I say, okay, very good. For those people who are not queer, anybody here have a relationship where you have to be emotionally deeply connected to them before you become sexually attracted? I said, oh, okay, well, somebody look up the term demisexual for me. Then they look it up and they're like, I said, oh, what is that? They said, oh, it's a subgroup of asexual. I said, oh, okay, keep going. Well, who is asexual? Is the A in LGBTQIA. I said, oh, Okay, so let me ask again. Who are the people in the room who are LGBT? Then now more hands go up. You don't know what you don't know.
Exactly.
And they're like, oh, I didn't know I was. Yes, you are. Yes, you're part of the community. So the language is evolving, the language is growing, we're learning new things every day. I want people to just lean in. It's a beautiful thing.
Absolutely.
Yeah. I was talking to this guy that I'm talking to on the phone, and I said, listen, I said, it's been a long time since I talked to a regular heterosexual man. And we actually just have like good high conversations, like really high level conversations. And I said, it's because I'm sapiosexual. So the term is sapiosexual, which is people who are attracted to intellect. So I want to have a deep conversation with you, like about something. And that to me is so sexy, right? So that's called sapiosexual. Now, sapiosexual is not part of the queer community per se, but it's just the definition of how you are attracted to people's like a smart person is so sexy to me, right? Now, I'm also asexual, which means I also need to be highly connected with you emotionally to now like have multiple orgasms or to now be really like sexually attracted to. And plus, I'm menopausal. So I need something to make me like really. And so I'm just saying that it's so multifaceted, even in the queer community. It's multifaceted. My dad used to think that he said, I know you're a woman, but you raised these 3 kids. When I thought I only had boys, he said, you raised these 3 boys. It's like a champ. He said, I think you have the spirit of a man. And I said, Daddy, you know what that is? That is 2 spirits. He's like, really? I say, yes. But in my language, we have a name for that. It was like, wow. I said, mm-hmm. So he is able to understand more and more about the community. So I'm just saying that it's a beautiful thing to just learn all the ways we can be without putting yourself in one box and saying, this is all I am. I want to learn more about myself. The other day I was talking to this guy and I was like, I would actually like to be like in a polyamorous relationship. So I realized I just can't get everything I want from one person. And I just think it's not fair for me to expect one person to give me everything. And because maybe the one that likes to read might not like to hike. The one that likes to hike might not like open mics, but I like reading, hiking, and karaoke, right? And I don't want to push one person like, well, you must give me. And the guy who's really good in bed, he may not be a good masseuse, but the one who is not so good in bed is excellent with massaging. I know, right? But in my mind, I'm like,
yeah.
And then enter the girl who's like 5'11". She's a baller. She's masked. Let's go, right? And it's like, I'm not hurting anybody. These are just ideas that I have. And you know what? Life is so short. So yeah, I'm just giving people permission. When I was younger, I thought I've just married this one husband and that's it. And then I realized that my ex-husband, there's so many things he just couldn't do because he just doesn't know how to do it. But that doesn't mean I'm not going to have that desire just because he doesn't know how to do it. Then I married my ex-wife, and as great as she was, there were some things that she just couldn't do. And it doesn't have to be sexual. And I just want people to realize that the world is so beautiful and so vast. And I just want us to just allow ourselves to just go there. It's a beautiful thing. Look, I love being older because now I'm like, oh, so that's available to me. Oh, wow. It's beautiful.
A lot of people go, well, I ain't gay. I ain't attracted to both sexes, but you need that emotional stimulation in order to have sex. So yes, you are a part of this community.
And period. Or maybe you're aromantic, which means you just don't really fall in love. Like you like somebody very, very much, but you're just not ever really falling in love. Well, that's queer, baby. That's aromantic is part of the community. Or maybe you're able to like love many people at different levels. But you don't think you're queer. You are. So I just wish people will just not look at transgender, which is just like one of like 36 different things, and just say, oh, because you're not transgender. Oh my God.
Yeah.
What a shame. Like what you're missing out on. And another thing I want to say, because I know when people think about LGBT+, they always think about sex. I want to say this with my full chest. Everything is not about sex. And any woman will tell you today that it ain't always about sex. Like sometimes you just want to hang out and just be with each other just like any other couple, just hang out and just be with each other. And that's why for me as a demisexual person, bring it. Because it's like after the sex, it's like, okay, what else you got?
Exactly.
Nothing? That's it? No.
Exactly. Speak on it, because I'm telling you, a lot of straight marriages out here that are literally lacking.
Yeah, because for them, and you know, many women, that's what many women will tell you, girl, I wish I got out when I could.
Mm-hmm.
And so I said, no, I'm going to get out when I can. And so I filed for divorce at 39. Almost 20 years ago, I was like, no, there's more to life than this. No. This can't be all, this can't be it. So when you're not in the mood, then I can't be in the mood. Call in Tyrone, honey.
There you go.
You know, as long as you do it safely, and obviously talking about diseases and other things, that's a whole conversation, different. I just want people to heal their souls and heal their sexual minds. And let me tell you, I have been celibate for 5 years, just so you know. Since my last marriage ended, I have not dated anybody. I just decided I was going to find myself again. I was going to take 5 years to rediscover what I like, what my inner child likes, what suits my soul, what brings me peace. And so this year is year 5. And so this year, this June, this month, I just said, okay, I'm going to go back into the dating and see what's out there. And so I just met this guy who doesn't even live in this state, which is good. So we can get to know each other more. I just want people to allow yourself to heal also, because now that I'm older and I realize that there's nothing stopping me from just living out all of my wildest dreams. It doesn't mean I'm not going to go to heaven. Or the one thing doesn't have anything to do with the other. Give me someone, show me how you treat other people, and I'll tell you if you're going to go to heaven or not. It has nothing to do with sex.
Exactly.
Nothing.
And speaking of healing, what did healing look like for you personally as a parent that was processing your own emotions while still trying to fully show up for your daughter?
One of the mistakes that people have out there is like, you have to be fully healed before you can fill in the blanks. And that's okay for those who have to be fully healed. But like I said about being able to hold space for my parents and my kid, we also have the ability to do that. And what I did was I said to myself, after 3 weeks of being in fetal position and thinking, oh my God, my life is over, I realized that, you know what? I'm a queer woman. I'm a physician. I'm a pediatrician for that matter. I'm a mom, a sister, a friend. I said, if I'm going through this, there must be other people out there who are also going through this. And so I said, you know what? Let me see how I can help them. And that's how I was able to heal. And so I want people to realize that sometimes you can be with yourself and you focus on it, it's going to get bigger. Or you can say to yourself, you know what? What if I try to heal myself as I try to hold space for other people? And I was like, you know what? I can do that. And I keep learning every day, learning about myself, what I like, what I don't like, but also by helping other parents of LGBT kids, I learned so much more. There are other ways to be, right? I learned about demi boys and demi girls because one of my clients' child was a demi boy. I'm like, he's a demi boy. I had to go look it up. I started learning about other things. But if I had said, oh, I'm just going to stay here and try to wait until I heal, healing is a journey. You never get to the destination. You shouldn't. It's just too many little pieces. We're trying to unlearn from all the mess we've been told as children. That's why when you're taking therapy, you can't just say, okay, I'm done with my therapy. And that's why I say healing for me is a journey, it's a continuous journey. And the more I learn, the more I want to teach about it. And I find out that when I teach, I learn twice. So I'm getting better and better every day at being who I am, at being a better coach, at being a better mother, at being a better physician, at being a better friend. Somebody was telling me that, oh, he doesn't want to be vulnerable with me. This guy, he said, well, do you want to be vulnerable with me? I said, why? He said, because in the past, when he's been vulnerable with women, they came and they used it against him. I said, I know you don't know me enough, but I work with the most vulnerable population in the world, the LGBT community. And I said, if there's one woman in this world that can hold your vulnerability, is me, because it's the work that I do. I work with them. They're always unliving themselves up and down all day long. They're getting killed by their boyfriends. They're getting all these things that happen to trans women and queer people. I said, if there's anybody who can hold your vulnerability, it's me. And I said, what kind of women have you been meeting? Like, who uses somebody's vulnerability against them? But there are people like that. I'm not going to be naive to say that there isn't. But I told them, I said, you know what? If I'm going to be vulnerable with you, then I'm going to need you to be vulnerable with me too, because it's a two-way street. And so we decided, okay, we're going to be vulnerable to each other. And that is a different way of loving that I didn't know when I was younger. So for me, getting older, so fun. Falling in love now, so fun, because now I know what I want. When I was 25, I did not know what I wanted. At 35, I didn't know what I wanted. But now at almost 60, honey, I know exactly what I want and what I don't want. So healing for me is a continuum. I don't want anybody to bring any drama into my life. I don't want to bring drama into somebody else's life. We won't call it quits before we get there. That to me is healing. It's just continuously every day, nonstop.
And I love how you explain that, because a lot of people think that, again, healing is you go to your therapist for 8 weeks and now you're healed and you can move on with your life. And then the next thing comes and you go, oh no, I'm going backwards again. But really, it's just you're in a different chapter, and every chapter has its healing moment. So don't think that you have arrived just because you moved past one chapter, because here come another chapter. Because a lot of people think it's very linear when it comes to healing, and it's not at all.
Oh, that's a word. It's not linear. That's a word. It's like this.
Mm-hmm. It got to look like this, and if you ain't going like this, you're going the wrong way. And
yes,
it's all about the person and the person finding happiness within themselves. So don't let nobody tell you out there that you're on the wrong path or you're going the wrong way, because at the end of the day, if you happy, that's all that matters. Now, let's talk about your work. How has your work with families, healthcare providers, or communities revealed gaps in how we as a community support LGBTQ?
I think truly we've been talking about that all day today, and just the lack. So every May, I do a daily mental health minute. And every June, I do a daily queer minute. So I do one every day. And I think yesterday, the one I did was about queer Africans. I said, come closer. I said, we do know that queerness was very African until the colonialists came. Like, oh, why should women be the head of the household? Why should women be marrying other women? In Igbo land, where I come from, we had women that were called female husbands, and they took wives for a long time. If you go to the ancient Greek drawings, you see where they have two men facing each other, and they bury the two of them in the same whatever tomb together because they are lovers. If you go to the past, you see where there's ancient tribes that have a third gender, and they recognize them as females and males at the same time, and they have like special roles in the society. They're teachers, they're sages, they're healers. We believe that they have that extraordinary spirit of both sides. We all have male and female sides anyway, naturally. It's whether you can tap into both of them. And that's what I said. My dad was able to tap into my male side. I said, okay, Dad, I guess, I just did what I had to do to me. But he's older, he's wiser. He's like, no. You have a male side that's very, very dominant. I said, okay, well, I thank God for that. And so if God can make me have both and harness both of them, you have the same. And so you ask yourself, who told me that I cannot be this? Who told me this lie? Who? And so for me, my work is all about helping people unlearning their thoughts, the BS that they've been taught. Specifically for parents, I help them understand that affirming your child is truly as simple as A, B, C, D. And they're like, really? I said, yes. A is becoming aware that any of your kids could be gay. Honestly, just because this one is out doesn't mean that the other one is not out. We have families where there are multiple kids who are gay. B is believe your child when your child tells you that they're gay. Because why would a child just say, yeah, let me see, I'm gay? No, unless they're gay. And then C is you have to create a safe space in your heart and in your home for your child to grow and thrive. You have to make the house the first place that you're going to live, the first safe place and the last place they can be bullied ever. Your home should be a sanctuary. And indeed, you have to make a decision today. I'm going to support my kid no matter what. No matter what means, in spite of my church, in spite of my co-workers, in spite of my spouse, no matter what means, no matter, because studies have shown that suicidal youth who have one single affirming adult in their lives will not jump. And so maybe you're the last remaining safe space for this child. So make that decision and make it with your full chest. And then E is educate yourself and empower yourself about the community, about the nuances about the community. You can't finish learning everything. But for instance, pronouns are not bad. Pronouns is something that we learn about in kindergarten. Is how to refer to people. Now, neopronouns I get. Those are the zir and the zer. That's new. But for they, them, we use they, them all the time. If you walk up to this table now and see this water bottle, you'll be like, oh, somebody left their water bottle. So we've been doing it so that when I say, okay, I want you to use they, them for me, oh, now you have a problem. What's up with that, right? And then F is find community. Find other people like you, find other parents who have queer kids, and then finish strong so that you don't rely too much on your child to be your teacher, because your child still wants to be a kid. They still want to grow. Their job is not to educate you. Your job is to find queer people in the community who will give you the true information the way it is, like people like me, obviously, or whoever, right? That's your job, to find those people in the community and then get around them and learn as much as you can from them. Sometimes your kid can teach you, but most times your kid, that's not their job. If the doctor diagnosed your child with autism, you're not going to ask the child to teach you about autism.
Yeah.
And then with doctors, it's something similar. Doctors are just not taught in medical school. So my job is to teach them that when you freeze, oh, your next patient is transgender, you'll be like, oh,
Yeah.
What are you thinking? Because there's a thought in your head that's making you think, oh, this is going to be a difficult visit. I'm not a difficult visit. I just want to get medicine for my headache and go home. My child is not a difficult visit. She just wants to get her prescriptions and go home. So where did the idea of a difficult visit come from? Society.
Yep.
And so it really is about bias. It's about managing biases. That's the work that I do.
And this topic of conversion therapy has even reached the Supreme Court. Yeah, that's just a whole other topic right there. Now, resilience is a big part of this conversation. What have you learned about resilience from both your child and the families you work with?
I think the thing about the definition of resilience, and I don't have a rubber band. Sometimes I have a rubber band to talk about that. Let me use this one. So resiliency is the ability to pull, extend, and then snap back. I don't have a good rubber band, but it's the ability to expand and then snap back, to expand and then snap back. My problem with that is we expect the queer community to be resilient. Mm-hmm. And my question is, at what cost? Why do we expect the Jewish community to be resilient? Why do we expect the Indians to be resilient? Why do we expect, oh, this is a rubber band, thank you. I don't have one. See, this is resilience, is the ability to expand and snap back. Expand and snap back. One day, we expand and never snap back. Mm-hmm. So why do we expect anybody to keep expanding to accommodate you? One day it's not going to be able to expand anymore. So we don't want people to say, oh, that's a very resilient. They are being forced to be resilient. A newborn baby. I'm going to use transgender because at the age of 2, between 2 and 3, a child knows their gender identity. You don't expect that child to start managing the emotions of their parents. That's resilience where it starts from. So this is resiliency. And then what happens one day? My hands can't expand anymore. It's going to snap. We don't want that. We don't want anybody to have to deal with that. So while they like to say that the community is resilient, I try to push back. I said, what are you doing to make them resilient?
Right.
If you treat them normally, nobody will have to be resilient. This is not the olden days where we have a tiger, you have to go fight the tiger and come back. And even with that, you only go fight the tiger and come back. The tiger doesn't come home with you. But in this case, the tiger is coming home with you. And so you're constantly in a constant state of fighting for yourself. And that's why if you go on Threads, you see how in recent times there have been a lot of videos about gay men fighting. And so this lady said, I've never seen a gay man who didn't know how to fight. They've been fighting their whole life. Don't mess around with a gay man, you get beat up.
Exactly.
I won't believe it.
Exactly. Same thing about transgenders as well.
Same thing. I just use that as an example. It doesn't matter. Whoever, I use them a lot because we know what it's like to be the underdog. We've been telling white folks to leave Black people alone.
Mm-hmm.
And so once in a while, you know what happened with the white chair? That happened.
Wow.
You get beat up, you fuck around and find out.
There you go. Well, yeah, there you go.
Remember, was it?
Remember
when,
yeah, that was it.
Leave Black folks alone.
Period.
Listen, the only reason the police can get away with it is because they have a gun.
Mm-hmm.
If it's man to man, we'll beat them all up. Mm-hmm. Because it's been festering, and that's what I'm talking about, resilience. It's been festering. We don't want to be resilient. We want to just thrive. You see what happened? At one point, it's going to pop. And this one just popped. That's what I mean. We don't want to be resilient anymore. We just want to be left alone. I don't want to be special. I don't want to be strong. I just want to be myself, just like Black women and the cape, Black women and the superwoman. I don't want to be no superwoman. I'm not your superwoman.
Exactly.
I don't want to be one.
Absolutely. And Dr. Lulu, I want to get some advice for you for my families out there who may be struggling to understand their child and what they're going through right now. What is one honest message you want them to hear right now?
Check yourself, because your kid is fine. Your kid is okay. If your kid is gay, your kid is gay. If you can't accept that, that's not your kid's problem. That's a you problem. And so you have to ask yourself the same question I asked before. What are your thoughts about this? What are you thinking? Or that they're not going to have any grandkids. How many people in heterosexual marriages don't have any kids? Or they're not going to find somebody to love. Who told you that? My ex-wife and I were married for 10 beautiful years. So who told you that? What else? They're going to get diseases. Who do you know gets the most HIV right now? Heterosexual women? Why? Because men are on the DL? Because y'all won't leave them alone?
Yep.
Right? So I'm just saying, what are you afraid of? Ask yourself the tough questions. Don't let your child be the one to manage your emotion. Your child is a child. You're the adult. Be the adult. So I don't have any special advice except check your thoughts. Ask yourself, why do I feel this way? What am I thinking?
She said my favorite phrase that I always like to use, you better check yourself, because I'm telling you, it's a you problem, not a them problem. And, you know, I'm going to leave it at that, because I always say that when it comes down to anything, if you got to be judgmental towards it, or if you just feel like it's the worst thing in the world, that's a you problem. And, you know, honestly and truly, a lot of people don't realize that it's a you problem until you tell them, like how Dr. Lulu just told us, because I'm telling you, it's literally what's lying internally versus what you said externally.
And that's what's lying between you and your child. And let me tell you, if you're not careful, your child is going to walk away and never come back.
Yep. I've seen that too. Then look back, kept going. And they ended up successful and ended up in marriages. They ended up with families. They ended up with the friends. They ended up with the community. They ended up with the job. They ended up with the legacy. They ended up with it all, and didn't need mama or dad or a brother or sister supporting them along the way. So I'm telling you, it ain't going to stop them from getting to where they want to go in life.
You see, that's the thing. Parents forget that. For parents, your own parents didn't stop you.
There you go.
And I think they forget that. Your parents couldn't stop you. if they wanted to. You still did what you wanted to do. Same with your kid.
Absolutely. Absolutely. And sadly, we've come to the end of today's episode, but I do want to ask you, Dr. Lulu, looking back at your full journey, how do you hope your story inspired others today?
I think my biggest wish, if that's what you're asking me, is that there were more people like me who were radical, feminist, fearless females in their mid-50s doing the right thing, just being unafraid. Because you're only afraid, you're only as brave as your worst fears. Just being unapologetically unafraid to do the right thing and say the right thing. I wish there were more people like me. I wish. That is the legacy that I want. I shouldn't be the only doctor teaching doctors about this. There are many, many LGBT doctors out there, but they're just like, girl, you're brave. I'm like, really?
Yeah.
If we don't get together and start helping them unlearn, it's going to keep.
Yep. I know some doctors myself, and they going, yeah, I know about it. I'll get some training on it, but I ain't going to be the person that's standing in the class teaching it to nobody else. And I'm going, well, you're a part of the community. That's technically where you're supposed to be.
And I do want to hold space for them.
Absolutely.
Not everybody has the bandwidth, and that's completely okay. The day I decided to do this work, my kid came back from the Planned Parenthood and said, Mom, I'm done. I was like, done with what? She said, I'm done. I said, done with what? She said, I'm done teaching my doctors. I'm done being the one that is always this. And she would say, I'm done this and that. And what I really heard her say was, Mom, what are you going to do about it? That's what I heard. Wow. And that's why I started doing the work.
Oh, wow. Wow.
Yeah.
Thank you for taking the journey, and thank you for having the courage to step in the room and be the voice that your daughter needs and this community needs, because we really do need you out here, because a lot of people are afraid to step into this conversation for still fear of being judged. But I mean, it's literally how we all heal, y'all. And before we go, I'm definitely going to make sure we get all of Dr. Lulu's information. Let us know where we can find you on socials. Let us know about your services and how we can sign up. Let us know all the details.
I mean, my practice is called Dr. Lulu's Pride Corner, which is a life coaching and educating space for parents, family members, allies of the LGBT+ community, and queer people themselves who are looking for just a way of maybe coming out or how to support their kids. And really, it's just as simple as what I talked today. We just start from the basics. What do you think about your child? And some people have real problems, like they want to know about what schools to get their child in and other things like that. Those are also real things. I'm not going to say that everything's not beginning and ending your thoughts, but I mean, finding a school, not finding a school, finding a good church. I mean, just different things. So Dr. Lulu's Pride Corner on IG. It's a new IG page. I really want to get to 100 people. We're at 76 today. Please, y'all go find us and follow us at Dr. Lulu's Pride Corner with the S there. Dr. Lulu's Pride Corner. And just there's a calendar there. You can make an appointment. And then I have my own personal page, which is Coach Udaku, which is the same thing as Threads. But if you need help, honestly, if you Google Dr. Lulu, you will pull me up and just find me and send me a message and let's have a chit chat. Everything doesn't come down to hormones and surgery. Sometimes your child doesn't even want that. I know we didn't talk about that, but most transgender people, if you ask them, they don't even really want that, or some do. I mean, everybody has what they want, right? But knowing about it and getting yourself prepared about it is probably the best way to be about it. So just come, ask your questions. Let's have a chit chat. I have a 3 session. I start everybody with 3 sessions because my practice is like a membership. It's like a concierge practice. We start with 3 sessions. And then after the 3 sessions, if you still want to continue, then we continue. But I want to do at least 3 so we can see how you're doing, how you're thinking, what you're doing. And if the child is a minor, we don't include the child. But if the child is like a teenager or like a young adult, and you want us to include the child, we can also include the child. That's not extra money, but that's definitely maybe once or twice I can have a chit chat with the child and kind of get a feeling of what the child is thinking or what they want to do. But generally, if you come to the practice, we just talk about what are you really struggling with the most now. Most people tell me is outside influences. And so my work is to help you realize that the last time I checked, nobody will ever make you do what you don't want to do. And they don't cook your dinner, they don't pay your bills, they don't matter. But it's hard to understand. It's hard to understand that. And when they come, they start to say, I know she's your mother-in-law, but she's not going to disrespect your child. You have to put boundaries, so just things like that. But I think we have fun a lot of the practice. I do virtually, I do in person here in Atlanta. So it's all good.
And don't tell us about your books, where we can find your books as well.
My books are on Amazon, and I hate that I don't have a copy here of my new book. Are you coming on my podcast, Ask a Black Woman? Are you coming? Did you sign up?
I don't know yet.
Jontai, girl, you better come.
You need to send me the link. Send me the link.
Yes, it's called Ask a Black Woman podcast. You come and you're like my co-host. I'll have my assistant get it to you. But my book is called I've written 10 books, but the two that I'm really proud of about the LGBT community is the most recent one is called About Your Black Transgender Child, Answers to Most of Your Burning Questions. And then the one I'm doing right now is called First Do No Further Harm. That's for doctors, pharmacists, nurses, healthcare professionals who want to become affirming spaces for their LGBT plus patients. So those are the two books that I really want in the space of the work that I do right now. But they can get it on Amazon, they can get it from me, they can get it from my website, they can get wherever they want to get it.
Absolutely. And let everybody know the name of the podcast again and exactly where they can find that as well.
So my podcast for my work is called Moms for Trans Kids podcast. It's Moms, the number 4, Trans Kids podcast. And we have a lot of episodes, but we don't really record anymore because right now my focus is working with doctors. So it's just but we have a lot of episodes. I can listen to, 50 episodes or more. But I don't really work with parents as much anymore. I still do, but my new focus now is doctors and healthcare professionals, because as you know, when this new administration took over, they were coming for parents. They were arresting parents in Texas. So I want the parents to get a break so they can still reach out to me. I can still coach them, but that podcast, a lot of the parents that didn't want to come on the podcast and talk. So I was like, okay, that's fine. We can hold that. And so, but the one, my fun podcast, my new one is called Ask a Black Woman podcast. And that's where we just have a woman, any Black woman comes and they just ask a question and we answer the question on the show. Whatever question you want to ask, don't matter. So we talk about it on the show.
Absolutely. And I will be leaving all of that information down in the description box below. Do you have any final words for our audience today, Dr. Lulu?
I think just remember the A, B, C, D, E, F, and remember that, you love your child. I know you love your child, and love is not conditional. Love is unconditional. So when your child says, Mom, I'm gay, the 3 things to do is say, congratulations, say, thank you for sharing that with me. Thank you for trusting me with that information. How can I support you? Can't go wrong. We cannot go wrong with that.
Absolutely. And thanks again to Dr. Lulu for coming on and sharing her personal story. And if today's message resonated, please leave us some comments down in the comment section. Also, if you want more stories such as these, make sure you're subscribed so you never miss whenever we upload. Until we meet again, keep your healing intentional, your boundaries solid, and your peace protected.